And now for SA Bursa.
So now to scan the subacromial bursa, we're going to leave our patient in the same position. The landmark on one side of the probe is going to be the acromion. The orientation of the probe is going to be at about a 45-degree angle, with one side of the probe pointed up towards the ear, the other side of the probe pointed just lateral to the biceps. The movements are going to be slight angulation until we get the bone nice and bright, and also the tendon of the supraspinatus nice and bright. The area of interest is going to be below the deltoid and under the acromion, which is where the subacromial subdelta lies. So that's the positioning for the subacromial bursa.
Okay, now on to draw it. Now, those of you who've used ultrasound before will notice that my markers or my indicators over here, and that's supposed to match up with that. Don't worry about this. Again, this is a staged setup, and we're just trying to teach you the sonoanatomy. Don't worry about that too much. So what do we see? Well, we know this bright white line here is the humerus, and here is the acromion process of the scapula. Cartilage, well, all this black stuff here is articular cartilage. Now, this happens to be unossified fibrocartilage, but that's probably a bit more than we need to know at this time. Joint fluid, well, we can't see any joint fluid, but we know it should be down in here. Ligament, well, we can't really see any ligament there, and so we're just going to skip that part. However, in theory, this part right here is ligament of the GH joint capsule. Tendon, now this is what we really want to get to on this slide here. So here is the supraspinatus tendon. Now we're going to go back to fluid because I totally forgot to draw in the bursa. Now the bursa is essentially this bit here. Now some of it is fat and there is no fluid within the bursa, so I would say this bursa is essentially flat. So muscle, can we see muscle? Absolutely. We can see muscle up here, and this is the deltoid muscle coming all the way there, along with a little bit of deltoid tendon right at the edge there. Okay, so now that we've done that, we're going to clear that away one more time. Bone, bone, cartilage. This is articular cartilage, so actually we'll just stop right there. Fluid, well, we know there's going to be some joint fluid there we can't see, and this is the bursa. However, we cannot see any fluid within the bursa. It's totally flat. This one happens to be. Ligament, what should we draw for ligament? Let's put the ligament as right there because we know this is going to be what holds the humerus into the glenoid. Tendon, this is the big one. So here's your supraspinatus. And muscle, here's your deltoid. All right, clear that away. Time to move on.
Going to show you how to scan and inject the subacromial bursa. The patient position is supine with the palm facing up. The landmark is going to be the acromion. We now see that in view. The orientation of the probe is across the body like so. I'm now going to take this near edge and rotate it anteriorly until I get the nice curve of the humerus right there. My subacromial bursa is so. The placement of my needle is going to be about 1 centimeter below the probe, in plane in this angle, and the needle tip will land right where the yellow arrow tip is now.
Hey, congrats on finishing that section. Can I show you inside one of our live courses? Let's go.
I certainly can say that Frank's courses are very well structured, very well taught, very practical.
Just even being able to use ultrasound in like the top 25 conditions are the ones that we see in clinic.
There's a huge community and a huge well of knowledge when you join one of the courses and you have access to all of these people who have seen a lot more than you have, and there's no guesswork. You leave feeling very confident with what you need to do to be successful for your patients and then in your practice.
You want to be able to do basic hip injections, shoulder injections, elbow injections, and I think Frank Johnson set up a very good protocol and a very good syllabus to be able to get the top type of procedures you're going to be doing in clinic and make sure you understand those well before moving on to the next step.
My revenue went up
almost instantly. There's always now just more opportunity to reinvest into my clinic, reinvest into the things that I like, and I've been very satisfied.